Welcome back to The Exam Room, a podcast where we dive deep into the world of value-based care, patient-centered healthcare, and improving health outcomes with your host, Dr. Rhiannon Winsor. Dr. Winsor is a certified surgical technologist, healthcare educator, and the manager of training at VB Care Network. With almost 30 years of experience in healthcare and instructional design, she's spent her career helping clinicians and care teams optimize patient outcomes. In part 2 of our conversation with Dr. Bhatt, cardiologist and Chief Innovation Officer at the American College of Cardiology, we take a deeper look at what human-centered care really means in today's data-driven healthcare system. In this episode, we explore how digital tools and AI can reduce administrative burden, restore meaningful connection between clinicians and patients, and help healthcare teams focus on what matters most: empathy, understanding, and trust. We also unpack the role of AI in patient engagement, loneliness, consent, and data overload, and why the future of healthcare isn't about choosing between technology and humanity, but designing systems that support both. Let's step back into the exam room.
Do you think we're moving away from human-centered care or more towards it? And tell me what your thoughts are about that.
Yeah. Right now, human-centered care has changed from when I first started practicing to recently, right? 20 years ago, practiced out of something that felt like it was, in fact, a 2-bedroom converted apartment. My patients waited for me as long as they needed to, but I knew everything about them and the picnic last Sunday and their uncle. And I kind of love the idea of hanging a shingle and being a small town doc.
Yeah.
The majority of healthcare today is not that. It is 15 minutes. It is kind of, an awkward blue paper gown. It is somebody else taking your intake. And I think it's not what anybody wants. It's not what the patient wants, but I will tell you 100%. It is not what the doctor wants. Nobody went into medicine to spend 15 minutes with you in a limited fashion when you are uncomfortable and probably unable to understand what they're saying. And you as a doctor have 100 different pieces of information that you need to collate in your brain about the person, and you just don't have time to connect. Where we are today is not human or patient-centric at all. If you can take away the administrative work, if you can help the clinician, whoever they are, doctor, nurse, community health worker, with AI, gather all that disparate information and put it in front of you as a story, and then let that person use their humanity to care for the patient in front of them, I think we have a great opportunity to bring healthcare back to what it used to be. And it's no one's fault that it's gotten this far, because science has grown so much that there's just more data, right? There's more to know and there's more to potentially do. It's nobody's fault that we've ended up here, but it's a really clear time where we say, if we use the compute power of digital health and AI to give doctors, nurses, community health workers the information in their hands, and then let them do the human part of caring, gosh, we would get back to 20 years ago in a year, 2 years. We're so close. We just have to enact it.
I agree that I don't think we're quite there yet. I was attending a webinar and there was a couple physicians there that one ran a very big practice, the other had a fairly small practice, but they had started using an AI tool to help them summarize all of this data. And I want to talk more about data later. From the physician's perspective, they felt that this really cleared a space for them to just sit down and be there, be present with their patient. And I thought that sounded fantastic.
Yep, that's exactly right.
Yeah. My next question for you has to do with empathy. So if we're putting all of these digital tools into place, how do we keep our patient feeling like that it's not just a tool that's doing something for them?
I mean, I think at the end of the day, the tools need to be in the background. You need to give consent. You to know that AI is involved in helping your doctor gather your information, care for you, record your notes. I think when a clinician or a health system or a practice is using AI, it needs to be in the background. It's helping out. Patients need to give consent for its use, but it allows you to spend more time face-to-face, learning, educating, et cetera. Separately, there's a role for AI directly to patients. There's a role for AI to say, hey, there's only 2 administrative assistants in this practice. We have thousands of patients. I'm an AI chatbot, but if you need to just reschedule your call, I can do that for you. It's not offering healthcare. It's literally doing just the logistics of care, right? So I think there's some places, or there was a study of post-discharge nursing calls done by an AI agent. And, she was the nurse and she'd say, I'm an AI agent. I'm calling to check up on you. Are you willing to speak with me? Okay, sure. If not, then you get bumped to a regular person. But if yes, then can you tell me, have you had any shortness of breath? How have you been feeling? Right. And it's an AI agent taking this information, processing it, and then if reassuring, saying, great, I'll give an update to your doctor. If not reassuring, saying, oh, hold on just one second. I'm going to get you somebody else to speak with you because it heard something dangerous. We have to calibrate those things. We have to train them well. But from a patient perspective, most of AI should be in the background, making life easier. And the AI directly interacting with them should be clearly stating it's AI, but then offering why it exists. That's kind of my take on the future of AI in patients.
How do you think that impacts patient engagement?
The patients I have talked to love when their patient makes eye contact with them, when their doctor makes eye contact with them again. And the doctor loves it just as much. I mean, making eye contact and not typing on a computer. God, if that's the only thing AI did, I would still be grateful, right? How do patients like interacting? It's a human thing. It's like if you call your car dealership and you get a human versus you get an automated thing. Some people are like, dude, it's a servicing. I just want to schedule my service. But other people say, well, I always talk to Cindy. Where's Cindy? That's just human nature. You can't account for all of it. And for those who want Cindy, they can just say, no, give me a human. And there's Cindy. But for all the other people who say, I don't have a relationship with Cindy over years, right? Part of this is generational. Like I think the Gen Zers, they don't have Cindy's necessarily. Maybe they do at Starbucks, actually. My daughter might at Starbucks. She might have a Cindy somewhere. But do you know what I mean? Like I think, so that's a human individual thing. And that's why we always give an out. Do you want efficiency at the current moment in your life? Do you need connection? Now, part of our problem is loneliness is an epidemic. So Vivek Murthy, who was one of our previous Surgeon Generals, had really declared it an epidemic. And so that can be treated both ways. Sometimes loneliness is better when you find a human and use somebody you talk to. And other times the humans don't have time for you. And so actually a really nice chatbot that has all the time in the world, because it doesn't have a list of people. The chatbot can run a million things at once. A really nice chatbot that spends time with you, that might actually solve for loneliness too. So it's hard to say. I think it's very individual.
Yeah, and not just AI, but I'm thinking about, because as an ACO, all of our partnering health centers are FQHCs. So they're in these rural parts of Arizona, and a lot of these are older people that are very isolated. And I think about just being able to use technology to connect them somehow. Like, is it peer groups, or is it, they can't drive, but they have their tablet, or, something like that. And we're working on developing an augmented health patient education that will have AI integrated into it. We're in our proof of concept phase 2. So we're very early on, but one of our hypotheses is that patient engagement is increased via the provider or the clinician or the physician. So that's one of the things that we're wanting to try to incorporate into our program that I think is different than a lot of other programs, is that we want it to feel seamless with their physician.
That's right. That's right. And that's why I think we go back to, it's not going to be digital health and health, right? It's really just health. And sometimes there is an electronic mechanism that's helping you, and other times there isn't. And I think that's kind of where we are. And I think it's really important to recognize that.
I want to go back to the data topic that we were talking about with all of these digital tools. A lot of data is being pushed to the patient, but a lot of data, the health center, the provider has to contend with. And I was just on a webinar, they were talking about Medicare Advantage and data analytics, and the list is a mile long of the data you need to look at provider data and SDOH data of your members and EHR data and all of this stuff. And how do they keep from feeling overwhelmed, and how do they sift through the things that they really need to care for their patients?
I'm going to go back for a second to when you said you work with FQHCs, right? Because I think so. Robin Kelly and Troy Balderson in our Congress have been focusing a lot on kind of digital health access to care, and Representative Balderson comes from a district that has, federally qualified health centers that he's been strongly supportive of. And we had a conversation with their teams and really thought about how do you ensure that you get the right data that represents your patients? And so I want to go for a second to thinking about AI, because digital health doesn't exist really today without AI. Like, there's just so much volume of data. You need algorithms to work through it, right? Compute power. We used to have this idea that all the digital health AI use has to be fully explainable. Like, if the human brain can't figure it out, don't use it. In fact, I used to teach that, right? I'm so embarrassed because life goes on, and now I have to change. But it turns out that AI is really smarter than us in certain ways in terms of bringing data together about an individual patient. And so now I tell people you need to understand the data coming in, and you need to understand the outcomes coming out. I want to make sure that my patient's social determinants of health are included, right? That other things are included. Having said that, that might not be their identity. And the exciting thing about nowadays is we have generative AI. So there's an opportunity to not only take your socioeconomic status, your zip code, whether you're cared for at a federally qualified health center, right? Things that may actually introduce bias in an odd way, both introduce us to who the patient is, but also introduce a bias. And then combine that with a patient saying, hey, here's some things you don't need to know about me. Here's what I value. That's what we're really getting at. Not who are you and how do I categorize you, but what do you value? And before generative AI, it was really hard. I worked a lot in patient-reported outcomes, right? Like, how are you feeling? But in how are you feeling, we rarely asked, what do you value about your health? And now with the ChatGPT type world, we can take all the data that you're talking about that tells us a holistic picture of a patient. But most importantly, we can ask the patient, hey, can you just talk into your phone and answer a couple of questions? What do you value? What do you want to get out of this visit? What's important to you? And then you'll hear things like, you know what? I would rather die than be disabled. I would rather have a heart attack than have a stroke. I really want to have this baby, and it doesn't matter what happens to me. I want to bring this baby into the world. Things that are really hard for people to wrestle with, where two people may feel totally different about something, but then people can give their own personal sense. And so I think there's a lot of opportunity with our ability to harness data. I think we know the basics, right? Which is most data is focused on certain groups of people. There's not tons of diverse data in this country. We need to get more real world data out of federally qualified health centers and other places to be able to define people. But I think the limitation would be if we said, hey, if I get all that social determinant data, all that local data on you, I know who you are. The truth is I don't until I ask you. And the way generative AI works today, the ChatGPTs, OpenAIs, other things in the world, actually you can get patients to just say what they want. And I think that's the part that I'm really excited about.
Yeah, my ChatGPT knows me.
Yeah.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.